living fully alive in every way. You're listening to Relationship Prescriptions with Dr. Carol.
As a parent, what would you do if your child had a serious mental illness? Hi there, friends. I'm Dr. Carol, and this is Relationship Prescriptions. For some, and perhaps for you, that's not a what if. That's a very real issue for 1 in 5 families in our country. That is a number that can be hard to sometimes wrap your mind around. 1 in 5 young people under the age of 18, kids and teens, have a mental health disorder in any given year. That is an enormous issue. Our mental health system, our school system, and especially our churches need to do better in helping families and young people deal with this very real issue. Well, we have a guest today on the program who is doing exactly that. Dr. Matthew Stanford has quite some credentials. Dr. Stanford is CEO of the Hope and Healing Center and Institute in Houston, Texas. He's a professor of psychiatry at Baylor College of Medicine and Houston Methodist Hospital. I could go on for a long list of credentials. He has written several books. His latest book, Grace for the Children, helps families, helps leaders in the faith community and others understand some of the issues that our kids and teens are dealing with, and provides some really insightful information and guidance in dealing with these issues. The perspective of recovery that Dr. Stanford provides in these materials has a lot of hope. As a parent or as someone else who deals with kids and young people, they have their whole lives ahead of them. And what better privilege than to help that child who is struggling find a path to recovery and a full life. That is the perspective that Dr. Stanford comes to this topic with. He is our guest on this program, and without waiting any further, here is my conversation with Dr. Matthew Stanford. Well, Dr. Stanford, it is a real pleasure and an honor to have you on our program today talking about something that's so important and so close to your heart, and I know to many families' hearts. And that is the whole area of mental health and kids and teens, and you have so much experience in this area. I'd like to start, if we could, just with unpacking a couple misconceptions that people may have around this area. And let me first just bring up the idea that some people think kids are just little adults. Some of them are smart, but they're not just little adults.
No, they're not. And, all we have to do is look in every community. We have a children's hospital to tell us that they're not just little adults when they have medical problems. And mental illness is just another medical problem. They manifest these problems in different ways. Sometimes the criteria are different. Certainly the treatments have to be different. We can't just give a child the medications that we give an adult unless we've tested them on children. And then they also have a lot of kind of tangential issues related that are different, such as there's parents involved and siblings and things like that. So we really have to understand that children are different than adults, and we can't just treat them that way. And their mental health problems are different. Some mental health problems simply don't manifest in children, whereas others are very common in children, like depression can happen at any age. And so we really do have to be cognizant of that and not just fall into kind of being lazy and say, oh, well, they have X, and so, the last time I saw somebody and that person just happened to be 25, I treated it this way, so I'm going to treat this 8-year-old the same way.
And you've alluded to another misconception, and that is that kids are just kids, and all you need to worry about is just appropriate training, but mental illness isn't really a factor. And I know that's been an area you probably have had to push back for in all kinds of places.
No, absolutely. I mean, there are people that, particularly parents don't want to believe that their child might have a mental illness, and there are even people that don't believe mental illness can even manifest in children, but they absolutely do. I mean, anxiety disorders and depression are very common. Anxiety disorder is actually the most common mental illness in teens, whereas something like attention deficit hyperactivity disorder is the most common disorder in children. But beyond that, I mean, depression, as I said, can happen at any age, and we're seeing, increases in suicidality in children. I mean, there was a time when you would never hear about children, say, from 6 to 10 years old, that were dying by suicide, and unfortunately, it's becoming much, much more common.
Yeah, tragic. And some of that perhaps related to bullying, and that's a different topic, but the actual illness, that the mental illness can be an issue. A third misconception that probably strikes very close to home for many families, and that is the idea that some parents may have that if I were just a better parent, my kid wouldn't have this problem.
No, absolutely. I mean, parental guilt is one of the very first things that you deal with when you're working with a family, and a lot of times they come by that, really honestly. A lot of times, someone's basically told them that, or implied that your child is having this problem because it's a bad, of parenting issues. Typically with children, since we have this tendency to deny that they can really have mental health problems, any kind of aberration or abnormality or pathology that we see is put down of a kind of a bad behavior track as opposed to a mental health track. And so a child is disciplined or something in their environment has changed to force them to stop doing whatever it is they're doing. And a lot of times we look at the parent and simply say, well, if you just spanked him more or you hugged him more or whatever it may be, this wouldn't be there. But the reality is, and I tell parents this all the time, unless you abused your child, unless you are an abuser, you physically abused or sexually abused your child in some way, you don't have a role in their mental health problem because if you're just a loving parent who's doing the best they can, as most parents are, their mental health problem is a combination of biology and environment, and that are things potentially outside of your control. And now is the time where you can step up and you can be or play a significant role in their recovery, but you really don't have anything to do with the fact that they now are depressed or they are struggling with anxiety, and you really have to let yourself off the hook.
Thank you for saying that, and I pray parents take that to heart if this is something that they're struggling with. And that does bring up a question. Kids have different personalities. Kids are sinners too. How can a parent and others caring for children sort out, is this something that is just a immaturity, a child being a child, or is this a mental illness? That probably isn't a simple question, but I'm sure it's an important one for many families.
Yeah, and it's a difficult one. I mean, I think that, even mental health care providers might disagree on what they're looking at or what they see. So, what I would say is this: if your child is behaving or is expressing emotions or struggling with emotions or feelings or thoughts that are different than their peers, different than the average peer their age. So, my child seems really isolated. Is this significantly different than other children that are 8 years old, given his race, socioeconomic status, gender, all of those kind of things? Talk to your friends and say, what is your kid like during the day? What is, those types of things. Talk to their teacher. How is Jimmy act in class? Does he seem different than the other children? If the answer to those are, yeah, this is not what I see in an average 8-year-old child or however old the child is, then there's nothing wrong with going and getting an opinion from a mental health care provider. I think that's really part of the issue, is that there's such a stigma associated with this, and parents don't want their children to be quote unquote labeled. They're so nervous to go and see a mental health care provider. But, if their child, tugs on their ear a little bit, they have them into the pediatrician so fast they make your head spin,
Yeah.
whether they're complaining of a problem or not. So, because there's no stigma associated with that. So, ask other parents, ask the teacher, ask your spouse or your partner if you have one, what do you think about this, and then go and have a mental health care provider. Just go in for a consultation. You're not committing to anything. You're not labeling your child. You're getting some expert advice, and there's nothing wrong with that. And if you want to do that relatively anonymously so people don't see it, then make an appointment across town at a mental health care provider. You don't have to tell people that you went if you're concerned about it. There's nothing wrong with going, but that's how you have to get the information. Remember, a lot of times, particularly if it's your first child or it's your oldest child, your experience with other children is pretty limited. Talking to a teacher about, is my child's behavior different than the average child their age that you've seen in the past? That can make a world of difference and really give you some good insight.
Dr. Stanford, in Grace for the Children, you give a lot of vignettes. And one thing I noticed in reading some of those stories is it's relatively frequent where a parent will find a sense of relief to now understand, okay, this is what we're dealing with. It doesn't necessarily make things immediately okay, but it gives parameters. It gives something that now you can address this challenge with my child. Now I have some help. Even though a label may be negative, at least it gives something that you can do something about.
No, absolutely. I mean, I think with most, you even hear that with, more kind of what people might generally think of as more frightening things, that they find out they have cancer or something like that. A lot of times people will say, well, now I know. So now I know what, now I know what I'm up against. Now I know, where we can start. Now I know that there's a plan for treatment. And it's the same thing with parents, particularly if they've, as we've talked earlier, gone through that kind of parent guilt, or maybe even been shamed by someone that, maybe you're just not parenting your child right, and that's why they're acting the way they are. If all of a sudden you now have somebody, a professional, that's saying, well, no, this isn't a parenting issue. This is depression, or this is an anxiety disorder, and we have treatments for that. That's a huge weight off your shoulders, in the sense that most parents, another part of that parental guilt is, I caused my child to be like this, and now I have to fix them.
Right.
And the reality is that that you don't say that when you find out that your child has cancer. You run to, Cook's Children's in in Dallas, or MD Anderson, Texas Children's in Houston, or St. Jude's. You know where to go, and you have no thought that you're going to fix your child. And it's the same thing here. Now you know that there's something that can be treated, and there are people out there that can treat it. So a lot of times it is a great relief.
Yeah. You talk several places in the book about how the church, the body of Christ, interacts with families and their kids and teens with mental health issues, and that's not always been a pretty picture. What have you seen in that regard?
Yeah, you see all of that same stigma that we've just talked about. All the stigma that exists in the general population, works its way into the church. But the problem, and the kind of ugliness of it, is a kind of a spiritual crust is put on that, and it's not just that your child is a bad child, and that's the way they're acting this way. It's their kind of a bad child from a faith perspective. Maybe this is demonic. Maybe this is some kind of generational curse. There's a spiritual aspect to it that somehow makes them even worse than the person who says they're just a bad kid. Or on the converse, maybe it's you. You are a bad Christian. You don't pray enough. You don't get your child in Sunday school enough. You didn't send your child to that, this particular Christian school. You sent them to public school, and that's why these things happen. Again, it's a spiritual issue, maybe as opposed or in addition to the behavioral issue that the general population might say it is. And so, not only are you just a bad parent, but you're a bad Christian. And not only is your child suffering with these problems which society is shunning them for, but God is shunning them as well, because simply you are not a good believer.
How painful, how tragic. When you have a family, a parent who wrestles with that, how do you talk about the God factor? You have a lot of that in your book, and I'd love you to unpack that for a minute.
Well, I think, I think that you have to, number one, I mean, just because, we're Christians and just because we go to church doesn't mean we have to check our brain at the door, which it has always just boggled my mind that a lot of times we act that way. We've become extremely insular or as a group and in trying to not allow ourselves to become part of the world, we've kind of shunned everything that we might associate with. So, all psychology and psychiatry are bad and those types of things. Now, typically we don't do that with other medical areas, but we shun those. And how did we go through and help a family? I think the first thing we do is we say, look, God is a God of grace and love and care. And he says here in the scriptures that your child is a reward, that there's something given to you, that it's an honor that you have this child, and that he's going to be present with you as you raise this child, that your child has a purpose and a plan. And mental health problems or any medical condition don't, dismiss that. I mean, you see a lot more compassion and care given to families where a child has maybe a physical disability or maybe a cognitive disability like intellectual disability or Down syndrome or something like that. A lot more compassion is given towards the family in those situations. But, have a 12-year-old child that shows bipolar disorder and, they're just a monster that needs to be kind of ignored or feared. And so I think that, we need to kind of help them understand that, we live in a fallen world and these things occur, but, the purpose and plan that God has for your child hasn't been removed by that. And that even in the scriptures, there are examples of people of great faith that struggled with these things. And so your child can have a growing relationship with God. You can have a child that is happy and has a good quality of life, and that their life is not over. This is not a death sentence because they've been given a mental health issue. It may be a bump in the road. In fact, it may be a big bump in the road, depending on the illness. But a faith community is a place that should stand by your side and walk along with you and bear your burdens as God has called us to do. And that's another great aspect of our faith, is that God has called us to be together. So God is present, God is active, and God has provided for us a healing community. And all of those things are positives that need to be demonstrated to the family. And if they're in a faith community that isn't supportive, and then I'll be the first person to say that, they need to leave and they need to find a faith community that is supportive. And unfortunately, there are faith communities out there that are not supportive of families with mentally ill children.
In the book, you unpack biblical perspectives on many various categories of mental illness with kids and teens. And as I was looking through that, I just found it so encouraging. And for anybody who is struggling with that, I think that biblical perspective in the book can bring a lot of hope. Although they didn't have the language in biblical times that we use today to speak about mental illness, there are certainly the symptoms, the challenges, the problems, and Jesus didn't shy away. Especially in the Gospels, he connected with people, including young people, kids that had these kinds of issues.
No, absolutely. I think that, as kind of a science nerd, I mean, one of the things I like the most about the Bible, if you just kind of obviously remove the spiritual context of it, if you just kind of look at it as a piece of literature over, ancient literature, is the people that were involved in the writing of the Bible were incredible observers of behavior. And they were, one of the things that makes the Bible very different than most other, kind of holy scriptures that exist out there, is that it's got the warts and everything just written down in there. It's not sterilized and sanitized. I mean, there's some ugly stuff in there, and they write down what they see. And if you sit down for a moment and you kind of take off your spiritual blinders, because a lot of times we've kind of, we only see it, that it's all there. I mean, there are people with depression, there are people with all kinds of different mental health problems there, and God is present, God is active, God is using them. God, it isn't that these things, these kind of stigmas and myths that we see in the church where, you're separate from God because you have this illness and you have to get right with him. This simply aren't true there. They're just not there. And so, it's just the opposite. These people are broken and hurting and struggling and crying out for God, and He's there for them, and He's with them, and He's using them to further His kingdom. And so, and they're not chastised for their illness. In fact, just the opposite. Most often, they're comforted. And so, it's just, wonderful for me to see that in there. And one of my hopes for this, for Grace for the Children, and for an earlier book that I wrote on adult issues, is so people can look in the scriptures and say, hey, look, here's some people that struggle with the same types of issue that my child struggled with, or that I struggle with, and God is present in their lives, and He has a purpose for their life. And maybe for, like with David, David struggles with depression, but he's a man after God's own heart. So where is that somebody told me that I just needed to get my life right with God? Maybe they were the ones that were wrong, not me.
Yeah, beautiful. One of the things I think I appreciate most is your integrated perspective that children, as well as adults, made in the image of God, every aspect of life impacts all the others, and including, and perhaps especially in the category of mental and emotional illness, that physical factors, of course, mental factors, relational factors, and spiritual factors play into what may have brought this to be, and therefore also play into what is necessary on a journey to recovery. That integrated, holistic picture of humankind and of this particular child in specifically. Talk about that for a minute, if you would.
Yeah, I think some of that stigma and misunderstanding we have really is because we don't, as believers, we really don't appreciate or understand how God has created us, and we have a tendency to kind of think of ourselves as spiritual and then completely separate that from the rest of us, or whatever that might be. And I think if you look in the scriptures, and I always really like the Luke 2:52, where it says Jesus grew in wisdom and stature and favor with God and man. I kind of look at that as kind of the four aspects of what it is to be human. And so, body, physical, mental, spiritual, and relational. Mm-hmm. And so when we have a problem, whatever that problem may be, it affects us at all levels of our being, because we are a kind of a multifaceted unity of physical, mental, spiritual, and relational. So if we have a physical problem, it affects us mentally. And if we have a mental problem, it affects us spiritually. The things are interconnected. And so when we're treating someone, we have to engage them at all levels. And I see that and have seen that, through the years as I work with different clients. Mental health care providers will be the first people to tell you that, if you have a psychiatric illness, let's say, for instance, that you had severe depression, like very severe depression. If you just take medication, you will never be able to fully recover. And the chances of you being able to get off that medication, if that's the only treatment that you take, are just about zero, because it's the only thing that's even helping with your symptoms. Medications are wonderful. I have a PhD in neuroscience. I love medications, but the thing is that medication is just one tool in a tool belt. And they just are dealing with primarily what you think of as physical symptoms, or the kind of mental manifestations of physical issues. And they're minimizing symptoms. They don't treat the underlying cause of the disorder. To do that, you have to get into some kind of psychotherapy where you do a talking therapy. Well, but if you're a person that has bipolar disorder or many other disorders that causes relational problems, what about your relationships? Don't those have to be worked on? Don't those have to be rebuilt? Well, what about your spiritual aspect? If you are depressed and you feel worthless and of no value, and as depressed clients have told me 1,000 times, I can't pray to God because no God would listen to me. I'm so devout. I'm so worthless. I can't do it. Isn't that a spiritual problem? Shouldn't we engage the person? But so I think a lot of times what we do on the church side, we just focus on the spiritual, and in the medical world, we just focus on the physical a lot of times. And really, I think we need to, what I'm hoping is that the church will come back to a more holistic approach to care and say, hey, you know what? We're a multifaceted being. That's the way God's made us. And we need to make sure you're getting intervention and treatment at every level so that you can obtain a full kind of healing and wholeness. And so we want to help you with your spiritual life. We want to help you with your relationships. We want to help you with your physical life and your brain, and we want to help you with your mental life as well.
And with our topic today about kids and teens, it applies just as much to them. Looking for their, environment and the family dynamics, and so much that goes into a kid's life.
Absolutely. I mean, if they, you can really see that relational, component there as the tremendous stress on the parents and the siblings as a child is struggling with a mental health problem. Children do not have, back to some of the earlier things you asked, children don't have the verbal skills or the cognitive skills to be able to express what's going on in their minds. And so it's very difficult a lot of times to really understand that. So, you see that, the child is struggling with their own mental health issue. They see their parents being torn apart by that, and now they start to blame themselves for the marital discord. They blame themselves for the fact that their siblings might be afraid of them or not want to be around them or be embarrassed by them. I mean, all of those relational dynamics aren't going to just go away if you give a child some medication that minimizes their symptoms. It's not to say that you shouldn't give them that medication, but you shouldn't just look at that medication as a magic bullet and expect that everything's good now. Let's just act like nothing happened. All of those relationships have to be mended and rebuilt and made healthy. And it's the same thing about the way the child thinks about themselves. If all of a sudden their symptoms are minimized to a point that they at least can be functional now or stable, it doesn't make them all of a sudden say, oh, well, everything's great now, even though I believe that my siblings are all afraid to be around me. Yeah. I mean, again, you have to look at this in a very holistic or multifaceted way. So, the problem with a child is that children are actually much more difficult to work with, obviously, than adults, because, as I said, they don't have those kind of insight skills and ability to express themselves effectively. And so, another good example of things that we use with children, might use some art therapy or art, drawing, things like that, to draw out of them what's going on, what are they feeling, what are they thinking, whereas you wouldn't necessarily, use that with an adult. So again, the intervention is different, the way it manifests is different, the way it's treated is different. But all that to say, they absolutely are treatable. There's incredible hope. The vast majority of people, children and adolescents included, that engage treatment, that have mental health problems, will see significant clinical improvement. And if your child is struggling, and let's say they're 14 years old and they're struggling with some problem today, they have an entire lifetime ahead of them. And within the span of months to a year, your child's entire life could be turned around with the proper treatment and intervention.
Thanks for giving that hope. Dr. Stanford, as I was reading through your book, Grace for the Children, I thought of a friend of mine. They have an adopted daughter who was abused as an infant, rescued from that situation and brought into a safe home. Now she's doing well. She's in school, third grade, I believe. But because of, or perhaps related to some of her very early experiences, has some symptoms of ADD, ADHD, and there's been some disagreement between the parents about whether she should be on medication or not, and all of that. But she is doing so well, and I just it made me think of my friend and their child when I was reading through your book, that there is a lot of hope.
Absolutely, and that kind of discord between parents on medication. I mean, I literally had a family in here last week. That is so common that actually ought to be the book. It's like, why do parents argue about medicine? Because every couple that comes in with a child that's under the age of 18, one of them is okay with meds and one of them isn't, and it becomes a real problem. And really getting on the same page is so very important. and finding mental health care providers that you feel are your advocates and collaborators. I mean, you're their parents. You're the child's parent. You know that child better than any mental health care provider ever will, and you have to play a role in their care, treatment, and recovery. And if you don't, if you just kind of send them out to get treatment, and that's your perspective, like, I'm going to send them over here and these people are going to fix them, and when they come back everything's going to be great. Or if you are so heavy-handed that you won't take any advice or counsel from professionals, you're going to just do it yourself with alternative treatments and whatever, neither one of those is going to lead to an effective treatment plan for your child. But if you can find mental health care providers, which there are plenty out there, that will be your advocates and be collaborators with you in care, that want your child to be better just like you do, and you and your partner can get on the same, you and your spouse can get on the same page, absolutely can your child see recovery. And I will tell you, children know when their parents are not in agreement on stuff. I don't care if they have a mental illness or not. And so whether you've ever spoken about it in front of them or not, I promise you they know that one of you agrees with meds and one of you doesn't. And I wouldn't want to be the person trying to get that child to take medication if I know one of their parents is against it. Because the reality is you're just never going to be able to make progress. You're going to have constant resistance. So, you may not want your child to take meds. I don't want my child to take meds for anything. But if they need meds, then they need meds. Say to yourself this: I'm going to say that we're going to do a trial of medication for the next 6 months. I'm only committing to 6 months, but I am 100% committed to 6 months. And at the end of 6 months, we're going to reevaluate whether this has been effective and helpful, and whether the benefits outweigh the cost. And get on the same page and move forward. Don't kind of nitpick around at each other, because that just damages the child.
Oh, thank you for that perspective. Some hope there about thinking about meds. Committing for 6 months. Sounds like an awesome plan. Well, Dr. Stanford, I know we could probably talk a great deal longer. You have a lot of depth in this book for families dealing with a child in a lot of different categories. If people want to find out more about you or Grace for the Children, just where should they go? Where can they find out more?
Yeah, they could go to our website, which we have a website that offers all types of resources for families or individuals that are looking for care, as well as faith communities that would like to develop a mental health ministry. So if they go to mentalhealthgateway.org. It's just Mental Health Gateway, all spelled out, .org. They will find all kinds of resources and information and videos there that might be helpful to them.
And we'll make sure that link is in the show notes as well as a link to your book, Grace for the Children, Finding Hope in the Midst of Child and Adolescent Mental Illness. Dr. Stanford, it's been such a pleasure. Thank you for being with us.
Thanks for having me.
Wow, what greater pain than to watch your child struggle with a mental illness, and what more important privilege than to help them through the journey of finding recovery. Mentalhealthgateway.org, again, is the website where Dr. Stanford has a number of resources. Also, if this is something that is a factor in your family, or if you deal with young people, if you're a church leader, get your copy of Grace for the Children, Finding Hope in the Midst of Child and Adolescent Mental Illness. We will put a link to that in the show notes for this episode. Take advantage of that. There's a lot of hope here. If you take it seriously, take action, and as Dr. Stanford said, deal with the whole person, the physical aspects, mental aspects, spiritual aspects, and relational aspects of this child's life, made in the image of God. I want to thank you for being part of our podcast family. During this Christmas season, I pray that Jesus ministers to you in a very special way. And until next time, may God bless you.
Thank you for listening to Relationship Prescriptions with Dr. Carol. Our purpose is to provide trustworthy resources that help you and others live fully alive in every way, as God intended. If you would like to help others experience transformation in their lives and relationships, we invite you to partner with us. Text the word GIVE, that's GIVE, to the number 512-980-1620. Or visit our website at drcarrollministries.com/donate to make a one-time contribution or monthly gift. Your financial support allows us to expand our message and to help others. Thank you so much, and may God bless you.